Thank you, Austin, for hosting this, and thank the ASG for having this symposium, and great having a wonderful panel here. I have no disclosures. So I'm going to tell you a little bit about just a couple, 3 slides on what's the status of things in GI or on faculty. And this is a paper that Sandra Cazada, Luke John Day, who's in the audience, and I published just in Gastro, I believe in March, that just looks at the number of underrepresented trainees in GI, and you see that the percentage has gone down over time. This is AAMC data. While the total number of accepted fellows in programs have gone up, but there's been really absolute no change in the number of Hispanic, American Indian, or African American fellows. And on the right side is the faculty. The top blue line is Caucasian GI faculty. The red line is Asian faculty, and you see this bunch of lines at the bottom, which is the other underrepresented groups. And so we said that this is a leaky pipeline. We have less going into GI from underrepresented groups that aren't making it to faculty, and those numbers have not budged in the last 10 years. Now, if you look at the representation of all faculty in the United States, and this is also AAMC data, looking at 16 US medical specialties. This is internal medicine, peds, OBGYN, PM&R, derm, etc. Growing from 52,000 faculty to 129,000 faculty over the last 2 or 3 decades. Hispanic male and female is underrepresented relative to the labor market in all 16 specialties. African Americans or blacks, male and female, were underrepresented in 15 of the 16 specialties. The exception was OBGYN. White females were underrepresented in several specialties: internal medicine, surgery, radiation, and emergency medicine, ortho, with the trends worsening over time. And then that was at the assistant professor level, but if you look at the associate professor level, the blacks and Hispanic were more underrepresented in 2016 when this data was looked at compared to 1990. So even though we think we've made a lot of gains, we haven't made a lot of gains, at least in terms of academic faculty. The other thing is, this is emphasized by promotion and race. This is a this is a paper published just last year in the American Journal of Surgery, looking at surgery, obstetrics, internal medicine, and pediatrics. This was 20,000 faculty. And on the bottom graph here, I don't know if my arrow is showing on me here, let's see here, 10-year promotion rates, and they're broken down by whites, Asians, blacks, Hispanics, and others. So if you're at the assistant professor level in surgery, the promotion rates were about 34% if you're white, but drops to 19% if you're black. And this is true in all 4 of these subspecialties if you're black. This was not true for the other races. And if you look at retention rates, these are how are you likely to stay on faculty. And you can see there's some disparity compared to whites and other races for the level of assistant professor in surgery, the level of assistant and associate professor in internal medicine, and the level of assistant professor in pediatrics. And so that's data that's out there. Why is this? Now, there could be a lot of reasons into this, but as Sandra brought up, some of this could be done by unconscious hypotheses, unconscious biases that amplify over time. So some people call these schemas. They're expectations or stereotypes. They allow rapid but sometimes inaccurate processing of information, that fast brain Sandra talked about. And then if with intervention, these could be changed based on experience and exposure and teaching. So here's an example. If you look at 2 files who are applying for, let's say, a job interview, and they differ in name only, John and Jennifer, there may be biases. One's a female, one's a male. And I'll give you some later examples of this. But if you change the name to maybe more an African American sounding name versus a non-African sounding name, you got fewer callbacks if you had an African American sounding name, even if they had 6 years additional experience. This is a study performed. What about things that you do like sexual identity? So these were pairs of matched resumes from 5 different occupations Overall, if you said you were a treasurer in a gay student organization versus a non-gay organization, you had 40% fewer callbacks for gay applicants, and there were some differences based on states, because this was done in several states. They can also, sexual identity can bias evaluations. This was a study in which an instructor gave a lecture to 8 different sections in a communication course, and in half the sections he said, my partner, okay, as Jennifer, and the other half was as Jason. So the straight instructor received 22% more positive comments. Everything else was exactly the same than the gay instructor. And the gay instructor received 5 times as many critical comments just by changing the name. Nothing else changed. So, and also if you were a member of a minority group, they were perceived as less credible instructors. Here's one about parenting. So males and females. So a mother who might be active in a parent-teacher association, and someone who's a non-mother. They're a woman who doesn't have children, compared to a father who might be active in a parent-teacher association, and a father, a non-father, just a husband. When you evaluate equally qualified same-gender job applications, if you were a mother, you were rated as less competent and less committed to paid work than non-mothers, and you were less likely to be recommended for a promotion or higher and offered lower starting salaries because you had kids at home. Nothing else was different on these applications. If you were a father, in the same situation, you were rated as more committed to paid work than non-fathers and often offered higher salaries. Again, stereotypes, schemas, okay, from the 1950s and 40s. How about gender in leadership? So, same-sex groups, those seated at the head of the table, is often identified as the leader. If you put a male person at the table, most often identified as the leader. If you put it as female, it was identified as leader only half as often as a man at the head of the table, just by changing the position at the table, okay? Male type traits were more congruent with traits associated with leadership, whereas women were penalized for exhibiting male type traits associated with leadership. What does this do? All these things at different levels accumulate over time. Those biases at one stage, let's say early training, might lead to a slightly lower pay, a slightly lower job. That gets amplified by the next time. So after 20 different opportunities, you might be paid $20,000 less than someone who's had those opportunities. Or you might be in a higher leadership position than someone who's had the other lower level leadership positions. Those small advantages and disadvantages accrue over time. How do you combat this? As Sandra mentioned, the first thing is to recognize it. And as Sandra says at the University of Maryland, the University of Michigan, we mandate all our faculty and staff and our trainees undertake unconscious bias. And this is not an online thing. This is an in-person course. And leadership, so all of our division chiefs, associate chairs, clinical service leadership have to take a more involved course we call STRIDE, and there's the name there, because many of them are involved in the recruitment of faculty. They direct the recruitment. Another point to combat it is make sustained and conscious efforts to counter that potential bias. So our dean's office mandates a retraining minimally every 3 years. It could be more often than that, but minimally every 3 years. We try to ensure a diverse pool of applicants, and I'll show you some examples of that from the start, although that can be tricky depending on specialties. I recently chaired our urology chair search committee. It just turns out that 90% of urologists out there are guys. There's only 10% women urologists. So it's tough to get a pool that's mixed. But that shouldn't be the case in pediatrics and some of these other specialties. And use uniform evaluation tools. And I'll show you an example that we've moved to. Other ways to combat unconscious include providing a welcome environment during the interview. Even if you interview, avoid tokenism. you are the black candidate, you are the woman candidate, and everyone else is something else. That's ridiculous. But that's what happens oftentimes. The candidate should meet a diverse group. So if you have a woman candidate and they're going out to dinner with a bunch of guys, that's not good either. That woman's probably less likely to come even if she was offered the job. And this is also, you're not supposed to ask specific personal questions. People can volunteer information, but that shouldn't be going in the evaluation, particularly when you try to hire someone. Encourage circumstances that will allow candidates to be at their best. In other words, provide information up front so people aren't surprised. Don't provide information to one group of people and not to the other. Ask the candidate ahead of time if there's specific people they want to meet. Ensure diversity at their job talk. Invite people who show diversity of your institution at their talk. If it's all one group of people, that's not good for them either. And do a standardized introduction. You may have heard that there is some bias when you introduce a woman at a talk. You tend to use their first name. And you introduce a male, you tend to use Dr. X. Okay, so you have to be conscious to treat everyone the same way. This is one of those generalized job evaluation. First of all, how did you interact with that person? Did you read the candidate's CV? So you can check off these boxes. Did you attend their talk? So when the search committee looks at this, they can know how you interacted with that candidate. Notice all these questions on here don't have anything to do with race or gender or anything, or do you have kids, or what school do you want. This is about the quality of the candidate for the job that you're trying to hire the person for. So these are more standardized approaches that can help eliminate bias. This is just a quick study looking at symphonies in the United States. So if you look at symphonies before the 70s and 80s, they were heavily male, playing the violin, flute. There's women that can play these pretty well as well. Okay, so then there was a push to go to screened auditions. And what they started to do is they had to play behind a screen so you couldn't see the person. And another intervention is they put carpet in there. People could hear heels hitting the floor. So you put carpet in and you put screens. And look what happened. Outcomes changed, and when you saw the number of women people picked based on the quality of the music that they played went up dramatically over time because they were screened auditions, not biased. So when you take just the playing of the music, things started to equalize over time. Another thing is letters of recommendation. Letters of recommendation can be written in effect schemas. If you look at a lot of data from letters for men, they're longer, they have more references to their CV and their patients and their colleagues. The letters of women tend to be slightly shorter, more reference to their personal life, and they have to overcome things. And these are just some words, examples of some sample letters that's not from the letters I've written, but it's amazing how much she's accomplished. It appears her health is stable, or she is close to my wife. That has nothing to do with you applying for a job at all. But people write this kind of stuff in there. There are some pros and cons to these letters of recommendations. They certainly can point out the strengths of the candidate, and they should. They can identify a candidate's role in shaping the direction of a project or patient care, and they can identify the roles the candidate has played in these things. But you don't necessarily control what the letter writer does. Depending on the letter writer, sometimes letter writer biases what is or is not written. As some of the words I mentioned earlier. They may have information in there that's irrelevant to the job that you're seeking. And sometimes they're partly written by the candidates themselves, because they have the candidate kind of draft the letter and then they write. So you have to be, sometimes it's your own bias if that happens too. So you have to be careful about that. Now I'm just going to show you data. This is from our own Department of Internal Medicine at the University of Michigan. And as of June 30th, 2018, and this is, we had let's see if I get this arrow right, 334, so this is about a year ago, 42% of our faculty were women, and that's up when I came about 35%. The minority was about 7%, and then you can see the breakdown of our instructional or tenure track faculty at 30%, clinical was 53% women, and research was 31% women. So I just want to see, were we making gains? So I looked at the previous 3 years compared to the previous years before that. So we were adding at a clip of 45%, meaning that we were adding women faculty, which is good. We were adding at a clip of 30, we hired 34 minority faculty in that 3-year period. So we're clipping at 8% versus 7%, so that's good. And if you look at instructional track, which is the tenure track at our institution, we were adding at a clip of 37%, still not 50%, but that was better than the 30% at the snapshot, means we were gaining. And the same thing happened with clinical faculty. So now, more than half my clinical faculty is women, but we're not quite there on instructional track faculty. Another intervention, there was in 2017, a JAMA paper came out and said, there's a bias against women presenting in grand rounds. So we saw this article, and so I have a dashboard as chair of the Department of Internal Medicine at Michigan, so I added that on my dashboard, so go watch it. And look what happened. We went from maybe 0.25% women presenting to 45% women just by one intervention. Okay, so the things that you know about, you pay attention to it, and things could be changed. So the last thing I want to mention is interview experiences, because we know that a lot of our trainees may supply Europe as a future faculty. So many trainees who could be great faculty at an institution may not match at your institution initially. Okay, that doesn't mean they may not come around later on. We've had a lot of experiences with that. So even though they may not match, their positive experiences during their training interviews may encourage them to return later. I am a classic example of that. I was a trainee at the University of Michigan, left for 15 years and came back later in a different role, but I had positive influences from my experiences there. And those people, despite of not matching there or training there eventually, if they have a positive experience, they may pass that on to other people. The worst thing is that they had a horrible experience, like don't go there because they're biased on this, they're biased on this. So you gotta treat people, even if they don't show up eventually or match there, because it could affect your program down the line. Why is this important? This is data from the University of Michigan. This is all of our clinical departments showing that external hires, if you look at this, the last several years here, we hired 30% from the outside and 70% from the inside, because our training programs are often fodder for our future faculty. We wouldn't be able to do that if everyone said, hey, University of Michigan sucks, if that were the case in there. And if you look at the makeup of a lot of faculties at places, it's around 60 to 70% internally trained. So we're not different than most other academic institutions. But that 30% is important because a lot of those people had ties or they knew someone at the University of Michigan. So I'll stop there and pass it on.